Hi, everybody. It's Dr. Rhonda. I just wanted to do a quick check-in to see how everybody is doing. It has been a rough couple of weeks, and I hope you all are hanging in there and taking good care of yourself. Now, here's the thing. I know that a lot of us are at home. Either we're working from home or um, our spouse or significant other is working from home. The kids are certainly home. And we just are in a position where we just kind of have to hunker down and take good care of ourselves. So I wanted to check in and make sure that everybody is taking good care of themselves. And so one of the first things I want to do is to make sure that you monitor yourself, your friends and family also, to make sure that there aren't any symptoms of anxiety or depression that are kind of getting out of control and that might warrant some extra attention. So symptoms of depression and anxiety would include things like impairments in sleep, impairments in appetite, poor attention, poor concentration, that you may be bickering a bit more than normal, feeling sad, just generally feeling sad, like you don't want to get out of bed and you don't want to eat, increased heart rate, increased like heavy breathing kinds of things, just a general lack of focus, those kinds of symptoms we definitely want to be paying attention to. And if you notice in yourself that you're feeling some of those symptoms, or you notice in your loved ones or your friends that they're feeling that way, you want to make sure that you reach out to your primary care physician. Maybe they could give you a referral to speak to a therapist if you don't already have one. And if you're a client of mine, call me and we can get you in for a telehealth conference. So we're doing a lot of things virtually so that we can arrange for that to happen, so that we can kind of chat and check in and make sure that you're doing okay. For some folks, if you happen to be listening and you're not a patient of mine, certainly the Department of Mental Health Services has teletherapy available, as well as just, on the back of your insurance cards, there should be a number for behavioral health. So if you kind of feel like you're having some of those symptoms, talking about it with friends and family is certainly helpful. So if it's not to the point that you think you need to reach out to a professional, certainly dialoguing about it, because we're all going through it. Other things that you can do is making sure that you're exercising. So if it's a sunny day, we are certainly allowed to go ahead and take a walk outside. I usually recommend, for the purpose of mental health, about 30 minutes a day. But since a lot of us might be home, you might even do that a couple times a day. So I know for myself, usually I wake up in the morning and take a walk. I'll do it midday and I'll do it sometimes in the evening. So I'll try to get that in there. And I've been getting a lot of steps in as a result of that. So that's really good. Because that will help you sleep better, help you focus better, and that kind of things, and you won't feel so irritable. Plus, if you married and your husband is working from home like mine, it at least gets you out of the house a little bit and to get some space, that kind of thing. So another thing, if you can't go outside, because like today's a rainy day, there are all types of like YouTube videos that will have like brief exercises. A lot of the fitness studios are offering free video workouts, and that's really great. So those are really cool to look into. Also, like there's a lot of meditation apps that are out there nowadays. So just on your phone, just get a meditation app, and even if you're just using 10 minutes of just doing some deep breathing, there's a lot of techniques out there, and a lot of things that you can get online for free that can kind of help you with meditating and calming yourself down. So monitor your depression and anxiety. If it looks like it's kind of out of control, you want to reach out to your healthcare provider. Most of us are doing teletherapy. The Department of Health certainly has access to some teletherapy. Exercise is really good for you, so you want to make sure you're getting in at least 30 minutes of exercise a day, and I recommend more. Reaching out to friends and family and talking is going to be really important. Establishing a regular routine, like going to bed, at a decent time and not staying up all night, waking up in the morning, and, planning your day. So those things are all going to be really good things to help us sort of get through all of what we're going through. I'm going to check in with you again, but for now, be well and have a safe day.